Answer questions 41 and 42 on the basis of the following information. You are called to the home of a 68-year-old female who is complaining of severe dyspnea. She states that it started about 45 minutes ago and has been getting progressively worse. She has a cardiac history but denies chest pain at this time. Her breathing is very congested. During your assessment, you notice accessory muscle use and rales bilaterally.
41. Which of the following conditions is this patient most likely suffering from? A. Pulmonary embolism. B. Acute pulmonary edema. C. Pneumonia. D. Lung cancer. Answer: B. Acute pulmonary edema. Rationale: rapid onset, rales, accessory muscle use, and dyspnea are classic symptoms for a patient with acute pulmonary edema. 42. In addition to oxygen, this patient should also be treated with which of the following medications? A. Albuterol. B. Dopamine. C. Lidocaine. D. Morphine sulfate. Answer: D. Morphine sulfate. Rationale: morphine sulfate would be an appropriate treatment for acute pulmonary edema. It increases peripheral venous capacitance and decreases venous return, improving ventilation and decreasing myocardial oxygen demand. 43. A pregnant patient complains of painful, irregular labor contractions. The patient states that she is 37 weeks pregnant and her amniotic membranes ruptured 2 days ago. Based on this information, you would: A. Perform a field delivery. B. Initiate immediate transport. C. Inform the patient that she is experiencing Braxton Hicks contractions. D. Tell the patient to call when her contractions become regular. Answer: B. Initiate immediate transport. Rationale: immediate transport is indicated for this patient's condition. Without the intact protective amniotic sac, the fetus is at risk of being infected. 44. What is the primary treatment of metabolic acidosis? A. Having the patient rebreathe his or her own carbon dioxide. B. Ventilating the patient adequately with oxygen. C. Administering sodium bicarbonate for 1.0 milliequivalent/kg. D. Determining and treating the underlying cause. Answer: B. Ventilating the patient adequately with oxygen. Rationale: treatment of metabolic acidosis consists mainly of adequate ventilation. Administration of sodium bicarbonate is rarely needed. Rebreathing CO2 is a treatment for respiratory alkalosis caused by simple hyperventilation. Identification of the cause of acidosis is not as critical as identifying that it is present and beginning corrective measures to prevent its worsening. 45. Which drug is an example of a beta-2 agonist? A. Aminophylline. B. Ipratropium. C. Labetalol. D. Albuterol. Answer: D. Albuterol. Rationale: albuterol is a beta agonist that is used to cause bronchodilation in patients with asthma and other respiratory emergencies. Aminophylline is a methylxanthine in the same class as theophylline. Ipratropium is an anticholinergic bronchodilator. Labetalol is an alpha and beta adrenergic blocker. 46. What is the condition that is present when the pleural space expands because air enters from an interior wound? A. A closed pneumothorax. B. An open pneumothorax. C. A tension pneumothorax. D. Traumatic asphyxia. Answer: A. A closed pneumothorax. Rationale: closed pneumothorax occurs when air enters the pleural space from an interior wound. An open pneumothorax occurs when the chest wall is open so that air can enter directly into the chest from the outside. A tension pneumothorax develops when a simple pneumothorax becomes large enough to cause pressure and structural changes within the chest. 47. Which of the following statements is true in regard to the pre-hospital management of a very ill neonate? A. Early placement of a tracheal tube is critical in early respiratory distress. B. High-flow oxygen carries a risk of oxygen toxicity. C's interventions should be reassessed at 30-second intervals. D. Allow the parent to hold the infant during treatment. Answer: C's interventions should be reassessed at 30-second intervals. Rationale: interventions during a neonatal resuscitation should be assessed often so that changes are noted as soon as they occur. The parent should not hold the infant, although it may be helpful to have them close by. 48. What does the term stridor refer to? A rattling sound associated with fluid in the upper airway. B. A whistling sound heard upon expiration in asthma patients. C. A gurgling sound resulting from fluid in the lower airways. D. A high-pitched sound upon inspiration from airway obstruction. Answer: D. A high-pitched sound upon inspiration from airway obstruction. Rationale: stridor is a sound made during inspiration and is associated with croup and upper airway obstruction. 49. A patient who is 37 weeks pregnant is having contractions and states that her water broke about 20 minutes ago. The vaginal exam reveals that the baby's foot is present in the birth canal. Your next action would be to A. Move the patient to the cot and initiate rapid transport. B. Turn the mother onto her stomach and prepare for a field delivery. C. Apply downward pressure on the symphysis pubis to delay delivery. D. Place the mother on her left side and prepare for a field delivery. Answer: A. Move the patient to the cot and initiate rapid transport. Rationale: a single-limb presentation is considered non-deliverable vaginally and requires rapid cesarean section to successfully deliver the infant. Rapid transport is indicated. Answer questions 53 to 55 on the basis of the following information. You are called to the home of a 17-year-old female who was found by her parents hanging from a rope in the garage. The patient was cut down by her father approximately 6 minutes prior to your arrival, but she is unconscious and unresponsive to pain or voice. She is breathing spontaneously, but has coarse inspiratory stridor. 50. What is the primary treatment for a patient with chronic emphysema who is not severely hypoxic? A. Ventilating with high-flow oxygen via mask. B. Administering low-flow oxygen via cannula. C. Nasotracheal intubation and high-flow oxygen. D. Orotracheal intubation and high-flow oxygen. Answer: B. Administering low-flow oxygen via cannula. Rationale: patients with emphysema or chronic bronchitis benefit from administration of low-flow oxygen and constant monitoring. 51. Epinephrine 1:1000 may be indicated in A. Asthma. B. Epiglottitis. C. Pertussis. D. Emphysema. Answer: A. Asthma. Rationale: as a bronchodilator, epinephrine 1:1000 is sometimes indicated in younger, less than 35 years old, asthma patients. 52. You're on the scene of a vehicle crash involving a bus. As triage officer, the first patient you encounter is sitting on the ground, conscious, confused, and breathing 40 times per minute. She states that she was thrown out of her seat and struck the side of her head. Your next action would be to A. Supply oxygen by non-rebreather mask. B. Check the radial pulse rate. C. Classify the patient as immediate, red. D. Apply a hold, green, triage tag. Answer: C. Classify the patient as immediate, red. Rationale: a patient who is conscious and breathing over 30 times per minute is classified as immediate. There is no need to check for the presence or rate of the pulse. While she may need oxygen therapy, now is not the time to do so. 53. What is the most probable cause of the inspiratory stridor? A. A trachea that is crushed or torn. B. A cervical spine lesion from trauma. C. Bronchoconstriction due to trauma. D. A foreign body airway obstruction. Answer: A. A trachea that is crushed or torn. Rationale: the inspiratory stridor most likely indicates an edematous crushed or torn trachea. 54. Upon examination of the patient's upper chest and neck, you note the presence of a large swollen area that extends from her throat to her shoulder. When you press on this area, you feel crackles under the skin. What is this condition called? A. Traumatic asphyxia. B. Laryngeal crepitus. C. Subcutaneous emphysema. D. Subcutaneous embolism. Answer: C. Subcutaneous emphysema. Rationale: this patient's symptoms indicate subcutaneous emphysema. 55. Which of the following is an appropriate treatment for this patient? A. Cricothyrotomy or transtracheal jet insufflation. B. Airway management by the least invasive means. C. Laryngoscopy to determine the extent of damage. D. Administer epinephrine to reverse airway swelling. Answer: B. Airway management by the least invasive means. Rationale: It will be difficult to determine the actual extent of injury, so the least invasive airway technique is appropriate. Monitor vital signs and pulse oximetry readings to determine if perfusion is adequate. 56. Your partner and you are evaluating a patient experiencing a behavioral emergency. Your patient is visibly upset and is pacing back and forth. He is verbally confrontational, and his hands are in fists. At times, he displays aggressive actions, both physical and verbal. Which of the following actions is most appropriate for this situation? A. Observe the scene for danger. B. Conduct a patient assessment. C. Obtain information from bystanders. D. Physically restrain the patient. Answer. A. Observe the scene for danger. Rationale. Given the circumstances, not enough personnel are available to restrain this patient if he becomes violent. Conducting a hands-on assessment may not be possible given the state of the patient's behavior. Constantly being aware of your surroundings will provide the greatest level of safety. 57. What is the best mode of transport for a patient who has a severe traumatic injury and is in need of specialized care at a Level 1 trauma center? A. Ground ambulance. B. Helicopter. C. Fixed-wing aircraft. D. Air ambulance. Answer. B. Helicopter. Rationale. Aeromedical transport offers the advantage of rapid transport to specialized facilities such as the Level 1 trauma center. The amount of time needed to extricate the patient, coupled with the time to transport the patient to either the closest hospital or the trauma center by ground, is too much. Flying the patient directly to the trauma center is most appropriate. 58. What is a common initial sign of laryngeal edema? A. Difficulty breathing upon exertion. B. Cyanosis of the lips. C. Hoarseness of the voice. D. Stridor upon expiration. Answer. C. Hoarseness of the voice. Rationale. The first sign of laryngeal edema is usually a hoarse voice. 59. What happens to the alveoli in patients with emphysema? A. They become overinflated, but maintain their elasticity. B. They lose elasticity and blebs may form. C. They become congested with fluid, but do not rupture. D. They deflate, leading to complete lung collapse. Answer. B. They lose elasticity and blebs may form. Rationale. Patients with emphysema have a loss of elasticity in the alveoli due to prolonged insult. Bleb formation results in decreased ability of the alveoli to expand and contract and an overall decreased surface area of the lungs. Ruptured blebs do not result in lung deflation. 60. A patient with a history of myocardial infarction presents with symptoms of congestive heart failure. Which of the following best describes this condition? A. A sudden onset of severe chest pain with elevated blood pressure. B. A chronic condition characterized by persistent high blood pressure. C. Acute symptoms of fluid overload and impaired cardiac function. D. A gradual onset of reduced cardiac output with intermittent chest pain. Answer. C. Acute symptoms of fluid overload and impaired cardiac function. Rationale. This patient is exhibiting the classic signs and symptoms of congestive heart failure. His history of AMI indicates that he may have permanent damage to the heart and raises the possibility that he is now having an acute episode of failure.